All right. Okay, so this right here is the lacrimal gland. Okay, it's the tear gland. Okay. Diagonally opposite from it, okay, that is the tear duct. Okay. I don't know. I kind of think of this sort of cottage cheesy appearance as a lot, sort of a glandular-like appearance. That's the way the model shows it. So anyway, so if the gland is over here and the duct's there, that's like, you kind of think of the tears have to traverse the eye before they can drain. The other thing is the muscles, the extrinsic muscles of the eye. Okay? So there's 4 rectus, okay, and they're the most logical, as logical as anything could be, okay? Top, bottom, right, left, only of course it's anatomy. So there's a superior rectus, an inferior rectus, a lateral rectus, and medial rectus, okay? So it just uses the terminology.
We know which one is medial.
And well, on this particular case, okay,
oh, because the nose. Yeah.
The nose, also the tear gland. Yeah. Okay. And the other reason is because of the superior, which we'll get to in a second here. So there's the 4 recti, okay, and then there's 2 obliques, a superior oblique and an inferior oblique. Okay. Can you see the inferior oblique underneath there? Okay. So it comes in underneath to the side, so of course it's the oblique. Okay. The superior oblique is up here. Right up there. Okay, so it kind of comes in, looks sort of like a rectus. Okay, would you please move over to the other side? Okay. All right. It looks sort of like a rectus. Okay, but it actually kind of goes around a corner. Okay. The reason it goes around the corner is because the tendon runs through that little trochlea right there. Okay. This is the one that's controlled by the trochlear nerve, right? Okay. Okay. That's the trochlea, changes around. Okay, this of course is a tendon, right? Because they're muscles, they're attached to the eye, but they still have tendons just like other muscles. Okay?
That's the superior?
That's the superior, yeah. Okay, so the 6 eye muscles. Then the eye itself, and this one is sort of messed up, so we'll go to the other one. Okay. So there's 3 layers to the eye. The outer layer is the fibrous layer. Okay. So this white sclera, which of course you can see on everybody's eyes, is outer connective tissue. That's the fibrous layer. Okay. The other portion of the fibrous layer is the cornea, the transparent window that you're looking through. Okay. So it is of course optically transparent. You can't usually see it very well. Okay. If you stand alongside somebody and you look at their eyes from the side, you'll kind of see there's a little bit of a clear sort of window on top. There we go. Take a look. Yeah. Okay. Then you can see it. Okay. So that's the outer coat. Okay. Inside that outer fibrous coat, there is a vascular coat. Okay. The vascular coat has this. You can see the blood vessels, of course. Okay. This is the choroid. Okay. It's darkly pigmented. It goes most to the inside. And also, okay, it has the iris, which is the colored portion of the eye. Okay. The iris is actually muscular. Okay. It can either constrict down the pupil or it has fibers that can like pull it open. So it's controlling the diameter of the pupil here. Okay. And so the pupil, which looks like a black dot on people's eyes, it's not a black dot, it's a hole. Okay, you're like looking back into like sort of the equivalent of a dark room, so it looks black, okay? But it is not a dot, it's a hole that enters into the eye. Okay. All right, also, okay, on the inside, actually this may show up better on the other one. Okay. Whoops. There's this ciliary body. Okay, it looks kind of like fibrous. Okay. The ciliary body has 2 functions. This was discussed in lecture, of course, right? Okay. One is it's a muscle that controls the focus of the eye. Okay. And the other is it produces the aqueous humor, the liquid that bathes the anterior chamber. Okay. And then, what's that again?
What was it called? What humor?
Aqueous. You were lectured on the eye, right? Yeah, so, yeah. It's all in the notes. It's all in the PowerPoint, probably, okay? Also, so, see, there's our iris. Okay. There's our lens, okay? So the lens would go right in front of the eye. It's behind the cornea. So the lens is, again, it should be like optically transparent. If you see one of these like fresh out of an animal, it looks like a piece of really crystal glass or something like that, just about perfectly transparent. The ones in the dissections look opaque, but that's because they've been studied in fixative. Okay, the innermost layer is the neural layer. It's the retina. Okay, so there are two structures on it that you want to be aware of. Okay, the optic nerve leaves the back. Okay, those are all the little fibers reaching out. Okay, and also, besides the fact that the optic nerve is there, right there where it leaves the retina, okay, there's all these axons leaving the eye. Okay, and since they're all leaving the eye, there's no photoreceptors. So inside on the retina, where the optic nerve leaves, that's the blind spot. Okay. The other thing is this structure, which looks really insignificant, but it's not. Okay. You see that yellow dot? Okay. The yellow dot is called the macula lutea, which means yellow dot. Okay. It's the area of acute vision. Okay. There's a condition called senile macular degeneration in which you lose this. If you lose it, you lose all of your fine visual ability. You cannot, for instance, like say read, okay, because you wouldn't be able to focus clearly enough. When you look at things, that's what you're doing. You're turning your eye so that the image focuses on this macula lutea. Okay, that's the only spot that really has clear vision. If you stare straight ahead at something and hold your eyes straight and try to sort of be aware of your peripheral vision, you realize it's all very fuzzy. Okay, so this
Is that the same as the phobia?
it is not the same thing as the phobia. The phobia is an area in the center of it which has even more acute vision. Okay, but you can't really see the phobia here. Okay, it's a little pit.
So when you squint, you're trying to focus that area?
No, when you squint, you're trying to do something entirely different. When you squint, what you're trying to do is to use less of your lens, okay? What you're doing is you're squinting down into a very narrow range of your lens, okay? And so it's less optically demanding. When you're using the whole lens, if there's any distortions in it, it causes problems, okay? And when you squint down like that, what you're doing is you're using a very narrow part of it. Something similar that you can do is kind of like if you look through like a little narrow little hole at something, things will look like a better focus. It's because you're just using a tiny part of the cornea, okay? And so that it doesn't have to be perfect the way it does over a huge surface.